I'm just waiting on the green light for the Facebook live stream, and then we'll go ahead and get started. There we go. Dr. Poore, you may start. We're ready to start.
Good morning, everyone, and thank you for participating in this morning launch of the Do Right, Right Now COVID-19 Prevention Campaign. Before we begin, I ask that you please hold your questions until the end of the presentations. This event is also being streamlined to the Douglas County Health Department Facebook page, but we will only be monitoring and accepting questions from those on the Zoom call. At the end of the presentations, you may either type your question in the Q&A or use the raise your hand feature at the bottom of your screen to be heard. This presentation will be recorded and a link will be sent to anyone who is interested. I want to start by thanking all of our partner organizations and media outlets for donating their time and resources and joining us in this unprecedented effort to deliver a positive and important message to all Nebraskans. Every one of our partners understands the importance of sharing this campaign with their subscribers, friends, families, and neighbors. A complete list of partners may be found on our website. I would also like to thank Whit Guckman and his team for their unwavering support and dedication to making this campaign a reality. Vic and his team have donated countless hours to create a campaign that will resonate with Nebraskans in an effort to put an end to this virus. This campaign could not have started at a more critical time. Douglas County and the entire state are seeing an extreme increase in COVID-19 cases. It is imperative that we educate the public on how to fight the spread of this potentially deadly disease. In order to fight this pandemic, the Douglas County Health Department and the Omaha Community Foundation have teamed up to support this unified campaign. As the campaign grew, leaders from outside of Douglas County were brought in to the conversation. And through a partnership with the Nebraska State Department of Education and Nebraska Children and Families Foundation, the campaign has expanded to serve the entire state of Nebraska. The Do Right, Right Now campaign is slated to last 6 to 9 months and will evolve and reinforce each community member's role and responsibility in helping reduce the spread of the virus. Key messages reinforce wearing a mask, washing your hands, and watching your distance. We will encourage the public to get flu shots and get a COVID test if they have symptoms or have a known exposure. We will also promote mental health services, so important at this time. Once a vaccine is available, the campaign will educate the public on its benefit and how to get it. These messages will be promoted in a positive and upbeat manner using current data and research. A website has been developed to provide campaign materials and links to resources. Visit dorightnow.org for more information on the campaign. What makes this effort truly unique is the generous support we have received from TV, radio, print, and outdoor media throughout the county and statewide. More than 45 partners have signed on to donate, add space, resources to make this campaign possible, and to ensure that every Nebraskan hears and understands the importance of taking these preventive measures. Our goal is to reduce the rate of new cases and hospitalization across the state. This can only be done when all Nebraskans choose to do right now, do right. I'm joined this morning by Dr. James Lawler. Dr. Lawler is the Director of Clinical and Biodefense Research, the National Strategic Research Institute. He serves on the faculty of the University of Nebraska Medical Center's Department of Internal Medicine. Dr. Lawler has field experience treating Ebola patients and serves as a subject matter expert in the training of Department of Defense medical personnel working with infectious patients. Dr. Lawler, please.
Thank you, Dr. Poor, and it's a pleasure to be able to address everybody today in these trying times. So I'm going to share my screen, and hopefully this will work. All right, can everyone see my screen? Adi, can you see my screen?
Yeah.
Great. So I was asked to talk about the current situation in Nebraska, and I think that's important, but I also think that we should talk a little bit about where we're going and how we change that course, which is obviously the purpose of the Do Right Right Now campaign. I think that there are certainly times when listening to doctors and scientists are not going to help you. If you are making your business plan for your small business, or you're mapping out your offensive strategy for Saturday's game, then that's probably a time not to listen to doctors and physicians. But I think when you're in the most impactful pandemic that the world has seen within the past 100 years, that probably is the time to listen to scientists and physicians. And this is what we're telling you. We are in the most dangerous time of this entire pandemic. You can see on the left, our case counts are dramatically higher than they were in the spring, and they continue to go up at an alarming pace. Our current hospitalizations are also at a dramatically higher rate than they were at the spring. We are approaching 1,000 hospitalized patients across the state. And you can see that our doubling time for both of those metrics is between 2 and 3 weeks. And so that means 2 to 3 weeks from now, unless we are able to dramatically change course, we will see roughly 2,000 patients requiring hospitalization across the state. Given that we only have about 3,200 staffed beds to provide critical care services and med-surg services for adults in the state, you can see that that is an unsustainable proposition, trying to manage that number of cases. I can tell you that I've been in mass casualty situations in combat zones in Afghanistan. I've been in Ebola treatment centers in very austere conditions, and I have never been as frightened about the status of a health system as I am about the status of our health system in Nebraska right now. So what does it mean when I say that we have case counts as high as we do? I mentioned on the last slide that we have well over 100 cases per 100,000 per day occurring across the state, much higher in many counties. If you look at that rate for Douglas County, what that means is if you have an event size with 10 people, there's a 43% chance that somebody within that group is actively infected and shedding virus and poses a risk to others. This is why we emphasize eliminating gatherings of over 10 people because of the risk involved. We know that all of these interventions that we talk about are imperfect, and that's okay, right? So wearing a face mask is not a perfect solution. It does not prevent all transmission in all cases. Washing your hands and using good hand hygiene, eliminating large gatherings, none of these are perfect solutions, but when you layer them together like slices of Swiss cheese, all of a sudden they create a relatively impermeable barrier. But the key is combining all of these efforts and doing them consistently across society. And that's why we as doctors and scientists have been advocating for these measures to be put in place formally across the state. And the reason why we've asked for mandates is very simple, and it's because they work. We know that when mandates are issued and requirements come down from a state or local level, that people's compliance goes up considerably. This is just human nature, and it's been shown, I think, definitively and conclusively in studies that have looked at compliance for things like seatbelts, but also for face mask wearing, as you can see here in a study that was done by a group of economists from Goldman Sachs. This increase in face mask compliance in the states that they analyzed resulted in a reduction in cases and a reduction in fatalities. So that's why we have been, I think, relatively consistent in our support for those types of interventions. So what does this mean in terms of our future and our trajectory? So you've seen the projections, or at least the data that exists now for our case and hospitalization curves, and heard the projection that in 2 to 3 weeks we'll be at double that. Well, that means that we're now getting into the territory of North and South Dakota. So I scoured a few media sites last night to just look at stories that have recently come out of those two states. They're about 2 to 3 weeks ahead of us in their epidemic curve. So again, in that doubling period, when we'll get twice as many hospitalizations, this is what we're going to encounter. So an unchecked epidemic and approaching this idea of what people think is achievable as herd immunity doesn't just look like statistics and curves on a chart. This is what it looks like. It is unmeasurable, and I think for many people will be surprisingly high levels of suffering among families and communities within Nebraska. And people talk about that idea of being able to achieve herd immunity as a strategy for riding out this pandemic. Well, this is what that would mean in Nebraska. Over 7,000 deaths. If we think that herd immunity is achievable potentially at 70% community attack rate, which is, I think, a conservative estimate based on our current understanding of the epidemiology, that's roughly 1.4 million cases in Nebraska. And if we look at a 0.5% mortality rate, infection fatality rate, which is probably accurate, and it does mean that 99.5% of people won't die, but it also means that 0.5% will. And if you have a 1.4 million infections, that's a huge number. That's almost 10 times what we've seen already. So this is what we're staring down if we do not immediately change our trajectory and implement those layers of Swiss cheese and non-pharmaceutical interventions that I discussed. Thank you, Adi.
And now we'll have Dr. Bruner.
All right, thank you. I do not have a presentation like Dr. Lawler did, but I will tell you our situation out here in the Panhandle very much mirrors what he showed for the state. We have found a significant exponential rise in the last few weeks. Today hitting more critical timing where we're taking out our outpatient things and saving staff for inpatient things. We have looked to our city councils and our county leaders to help us with things such as mask mandates, as well as campaigns to, as that Swiss cheese model showed with Dr. Lawler, other protections for our populations. We are looking forward to our the vaccine that may be coming, as well as the immunoglobulin therapy that is coming across the state. But we have a stubborn population, and so doing the right thing right now is exactly what our population would need.
Thank you, Dr. Bruner. And now we'll have Governor Pete Ricketts and First Lady Suzanne Shore.
Great, thank you very much. And I want to say thank you to all the community partners who are putting together this Do Right Right Now campaign to get the message out with regard to the things that we need to do to slow down the spread of the virus. This is something that will dovetail really well with what we're doing already at the state of Nebraska and our communications campaign that has been leveraging radio PSAs and digital campaign. And this campaign will work together with that to be able to get the message out about how we as Nebraskans need to all step up and take care of each other. And that's something that, Suzanne and I are experiencing this firsthand right now as we're quarantining here at home. And we need to make sure that we're all following those rules. So if you've been exposed, you need to be able to quarantine for 14 days. You can't test out of that. You've got to be able to stay home to see if those symptoms develop so you don't infect somebody else. If you're sick, you need to stay home in general. Get tested to make sure you don't have coronavirus, but any symptoms, make sure you're staying home so you don't go out. We got to make sure we continue to follow the rules with regard to wearing a mask, going to the store once a week, going by yourself, washing your hands often, all the different tools that we have that Dr. Lawler described as the Swiss cheese to be able to slow down the spread of the virus. And that's what this communication campaign will do. Really, Nebraskans have always stepped up to take care of each other in times of need. We saw this last year with the flooding, and this year we need to step up again right now to get back to the great habits we had earlier this spring when we slowed down the spread of the virus. We need to start practicing all those things again right now to be able to slow down the spread of the virus and make sure we preserve that hospital capacity. So I want to thank the Department of Education, Douglas County Health Department, and the Nebraska Children and Families Foundation for their work to be able to help spread the message and make sure that all Nebraskans understand what they can do to take personal responsibility to step up and make sure we slow down this campaign or slow down this virus by doing right. So thank you again to everybody who's been a part of this. And again, Nebraskans, it's time for us to all do the right thing, do it right now. And just one further message I'd like to add is please allow a little space for grace along with that we need to make sure that everybody is going through a tough time, that we understand that we're all a little bit more forgiving with our neighbors. And with that, I'm going to go ahead and turn over to Chris Rogers, who is the president of the Douglas County Board of Health.
Thank you, Governor and Suzanne. As the president of the Douglas County Board of Health, I'm here to follow up on what Dr. Poore and Governor Ricketts have emphasized today. It's imperative that everyone do their part to end the spread of the virus. However, I want to take a moment to talk and to communicate to communities of color in Nebraska. Communities of color are structurally at a higher risk of likely being infected and dying from the virus. Across the country, African Americans are dying at a higher rate than any other group. Communities of color tend to live in more crowded, multi-generational households, not to mention the increased instances of underlying medical conditions that often go untreated. Those working in essential roles are less likely to have paid leave and therefore have a difficult time self-isolating and can't afford to quarantine for 2 weeks. It's critical that all members of the community follow the recommendations of this campaign. Wear a mask, wash your hands, and maintain 6 feet of distance. I also ask that everyone please get a flu shot. The Do the Right Right Now campaign is translated in Spanish to reach as many Nebraskans as possible. And can I say that particularly here in Douglas County, with the high number of refugee populations, we have resources here to help those that may be of the Burmese or the Somali population, other refugee populations that need assistance in emphasizing this campaign. We can slow the spread of the virus, but we need everyone to help. This is not a black, white, or brown problem. This is a Nebraska problem. Let's work together to do right now. It's my pleasure to introduce Matt Bloomstead, Commissioner of the Nebraska Department of Education. Matt was introduced to Vic and his team with the intent of expanding the Do Right Right Now campaign statewide. The Department of Education has been instrumental in expanding this campaign to all corners of the state. Commissioner Bloomstead.
And thank you, Chris, and thanks for everyone who's participating this morning. Thanks for the concerted efforts to communicate this across the state. I'm really pleased to be part of the campaign, and it's obviously an important piece in educating the community on how we can fight this virus. Today, you've heard some grim statistics. I guess the information is not new. In fact, none of the messaging really encompassed in the campaign is new. The campaign ultimately is reinforcing the things that we've heard from CDC and local public health and the governor as well, the things that have been said for months. The problem is that we're all grown a little tired of the pandemic, me included. We've started maybe to become a little bit lazy about following guidelines and want life to go back to normal. However, now is really not the time to ease up on these kinds of restrictions and what you do in your social lives and otherwise. As Dr. Lawler and Dr. Bruner have stated, our hospitals are feeling the pressure. Only really by working together can we overcome this challenge and reduce the spread of the virus. It won't be easy. I mean, the holidays are fast approaching. Obviously, this time of year is known for driving to grandparents' houses and our relatives' houses to have a delicious turkey dinner, gathering with extended family for Christmas and holiday celebrations, even at New Year's, and other such things that have been traditionally great opportunities to join together in large events. But now we cannot stress enough the importance of keeping the family gatherings small. This will be difficult, and we understand that. The holidays can really be a magical time of year, but in 2020, it brings just so much risk. It's been too easy to leave the mask at home, forget all of the other requirements that keep us safe. This year, however, we just have to think about our loved ones' health and safety, so they are around to celebrate the holidays with us next year. As 2020 comes to an end, many people are feeling emotionally drained. This pandemic has dragged out a lot longer than any of us thought. We want our kids in school. We want to be with family, and we want to tailgate at a Husker game. But once again, many are just feeling isolated as the COVID numbers begin to rise. It can be very difficult. I am pleased that this campaign also highlights the mental health aspect of the pandemic. The campaign highlights help that is available for anyone who is struggling. I encourage you to reach out anytime, day or night, to the Nebraska Family Helpline at 1-888-866-8660. Doing right now will help us eliminate the virus so we can all get back to gathering with families and friends and enjoying the activities that we all love. I thank you for the opportunity to be here. I'd like to introduce Donna Cush. Donna is the Executive Director of the Omaha Community Foundation and a great partner in this campaign. Thanks, Donna. I'll turn it over to you.
Thank you, Matt. We are a very proud partner in this campaign, and we see it as a natural extension of the work and the collaboration that already existed through the Foundation's efforts with Douglas County to help distribute CARES Act funding to more than 200 local nonprofits in need. At OCF, we believe that this public health effort complements the work that we see our nonprofits and other organizations doing every day to both mitigate the spread of COVID-19 and help keep our residents safe. We know local nonprofits continue to hurt as a result of the pandemic, and we're working with our generous Community Foundation donors to help address those needs. We're grateful to the many partners who helped make this campaign possible and are committed to amplifying these critical messages and ensuring that as a community, we're unified in our response. I'm going to turn it over now to Mary Jo with the Nebraska Children and Families.
Thank you, Donna. Nebraska Children is pleased to be part of this campaign. One role we will play is to serve as a fiscal agent for the statewide campaign. We have created a fund for public and private contributions. The Department of Education has already committed funds to get it started, and we're reaching out to private donors for contributions as well. The other role that we are playing is to get the campaign's messages out across the state through the Bring Up Nebraska community collaboratives. I just have to give a shout out to the community collaboratives. They have been working tirelessly since March to meet the needs of children, youth, and families that have been impacted by the pandemic. And they are in a great position to distribute campaign materials and to encourage people in their community to do what is necessary to keep themselves and others safe and healthy. We're excited to be part of this campaign, and we'll do our part to make sure that it's successful. So at this point, I'm going to turn it back to Dr. Poor.
Thank you, Mary Jo. And as the governor said, as Nebraskans, we pride ourselves on doing the right thing, caring for one another, working together to address problems and affect change. We can get the good life back when we do right now. Thank you again, everyone, for participating in this morning's launch of this important campaign. I would also like to thank our community and media partners across the state. You have been instrumental in helping us spread this critical message. We have a listing of our partners on the Do Right Right Now website. We will now take any questions.
First question is for Becca Costello.
Good morning. This is Becca Costello with NET News. Governor Ricketts, I have a question for you. We heard from Dr. Lawler there at the beginning showing some substantial evidence for why mask mandates work. And your opposition to mask mandates has mostly reasoning has been included that you believe they breed resistance. What is your evidence for that contradicts what Dr. Lawler presented earlier?
Well, again, we do have mask requirements in our most recent DHM for staff and patrons who are going to be closer than 6 feet away for more than 15 minutes. So we're using masks where it's appropriate in our DHMs. And with regard to how people feel about masks, you can attend the Omaha City Council meetings. We know that we had some protests, which thankfully didn't occur, but the billboards here in Omaha and so forth. So I think there's folks around who also still need to be brought on board with how we use all the tools that we have to be able to make sure we're slowing down the spread of the virus, masks being one of those tools.
Okay, thank you. The next question is from Danielle Shank with NTV. Why are you launching this campaign right now? Why not months ago? And anybody on the panel is free to take this.
This is Adi. I can take it. So this really started with an idea that Vic Gutman had, and it was in September. And that's when we brought the media together. And I tell you, I still remember that day. There were 20 people, 20 media outlets on Zoom. And we presented to them this proposal, not knowing what they are going to say, because there was a little wrinkle in it. We didn't have any money. So, however, I was so pleasantly surprised that day that we presented the proposal, and it didn't take a minute till the first outlet said, we are in, we want to participate. And from then on, every other outlet that was on that Zoom that day said they wanted to be part of this campaign. We decided that day that probably it would be best to do the campaign, to start the campaign after the election cycle, because the media is overwhelmed with information to present to the public before that. So that's really what we, and at the same time then, Commissioner Bloomberg decided that they wanted to be on this campaign too, and this would really be needed to be a statewide message. And so that's kind of why it was not intended to be at this time of the incidents that we have, but it just turned out this way.
Thank you, Dr. Poor. The next question comes to us from Ashley Richardson.
Hi, this question is for Governor Ricketts. Back to the mask mandates. We're seeing communities across the state kind of step up and start to implement these mask mandates on their own. Do you support that? Do you think that we should do it statewide, or could?
So I think, Ashley, you're cut out there a little bit, but I'll just jump in here. So I think that we should use masks. I've been talking about masks work. In our DHMs, we've got them, for example, where patrons and staff are going to be within 6 feet of each other for more than 15 minutes. I'm been opposed to a broad-based mandate with regard to masks. And with regards to individual cities that want to pass mask mandates, I would encourage them to check with their legal counsel on their legal authority to do so.
Thank you. The next question comes to us from Anders OJ. How will you know if the campaign is working? And anyone on the panel can take this.
I'll address a little bit from at least my perspective in education. One of my real interests in being involved is I heard a lot from our schools around the state and the challenges that they're facing, and the fact that as we work with all of our public health officials, that we've seen spread that's really coming from settings that have been, social settings and other things. And some people just, don't know how to prevent the spread of this virus. And so I think one of the things that will be important to look at is obviously what the community transmission looks like. I think also a bit about, I'll have some sense from our schools whether or not this campaign's helping to message within their communities all over the state. I think we'll have a good sense of that we'll see and hear this, and it'll become routine for folks to be following these protocols. So I think we'll see a lot of different things that are going to help us right now in this moment.
Thank you very much, Matt. We have a couple questions that came in through the Q&A chat in regards to different campaigns, such as remember the 3 W's or avoid the 3 C's. Why is this campaign different? How are we able to encourage personal responsibility better than the ones in the past? And anyone on the panel can take this as well.
I can start to take why I think this is so important is because you're talking about different media outlets. So on the bus benches, you will see the same messages as you see on billboards, as you see if I'm listening to one radio station versus another, or one TV station versus another. So it is this uniform kind of comprehensive message that you are going to hear from several different avenues, even if you may not listen in to one that has a specific campaign going on. So I think that is the strength of the campaign. The other strength is that this is going to last for 9 months and have different additions to it, whereby several of these campaigns, after a while, people kind of get tired and they think they need to refresh it and a new campaign comes in. And there were some campaigns out there that I didn't even know that existed because probably I didn't listen to it carefully. So this is the comprehensiveness, the statewide-ness, and the length that the campaign is going on.
Thank you very much, Dr. Poore. We have a question from Ashley Richardson.
That was my one from earlier, sorry.
Okay. We have a question from Becca Costello.
Yeah, I just want to go back to another thing that Dr. Lawler referenced, which is the doubling time of cases and hospitalizations. And a question for probably both Dr. Lawler and for anyone else on the call. Is this campaign enough to prevent us from doubling again in 2 weeks? It seems like, especially based on what Dr. Poore was saying, that these kinds of campaigns do take a bit of time to get off the ground and gain momentum so people are seeing it. So is this enough to do what needs to be done to stop, people from dying?
Well, I can start. I think if we were to implement all of those interventions that were outlined in the Swiss cheese diagram and to do them completely and well, then we could dramatically reduce community transmission tomorrow. But there is a lag effect where the momentum of the epidemic and the amount of time it takes for somebody who's been infected to develop disease and then get sick enough to go to the hospital means that we would still see increasing case counts and we would still see increasing hospitalizations probably for 2 weeks. And so there is a significant delay in terms of action and reaction that people need to take into account. And that's why setting metrics that have to do with arbitrary numbers of hospital beds being filled does not necessarily help you to prevent catastrophic impact to the health system, because you're reacting to events that really occurred 2 or 3 weeks ago versus events that are occurring now. And so if we're to act today, we'll still probably see that doubling still take effect or come close. And the longer we wait, the more that exponential growth will affect us.
Thank you very much. We have a question from Lisa Frick. I have heard that if everyone faithfully wore masks and distanced for 4 weeks, the COVID spread would be drastically reduced. How valid is this idea? Anyone on the panel is able to answer.
I guess I'll jump in there again. As I mentioned, if we were able to implement all of those precautions, if folks were able to wear face masks, religiously when they are in contact with people outside of their immediate household, if people were to social distance and avoid large gatherings over 10 people, avoid situations where they're in close contact with folks indoors, particularly in crowded settings. If we were to do all of these things tomorrow, we would dramatically impact transmission and slow it remarkably. Again, with the caveat that we would still have probably 10 or 14 days of growing case and hospitalization numbers as the cause and effect lag catches up. But these are effective. We know that these interventions, when used together, work. We've seen many countries that have been able to implement them successfully and have very low rates of transmission in the community and have not required full lockdowns and have been able to send at least primary kids to school every day. And so communities have been able to do that. I will also add that those countries and communities that have been able to implement those measures and control the epidemic are the countries that have had the least impact on their economic growth. And so those two things are linked. It is not a choice between preserving the economy and saving lives. Those two choices go together. If you can control the epidemic, you will limit the economic damage to your community. That's been shown, I think, conclusively in many countries.
Thank you very much, Dr. Lawler. We've had a couple comments in the chat and in our Q&A box. Wondering if First Lady Suzanne Shore would mind making a couple comments.
I don't. I just figured there were enough people speaking. You didn't need me to. I have to tell you, I appreciate this campaign. I think that we need to get the message out as many times and as uniquely as possible. So having multiple campaigns is not a bad thing because we're reaching so many people in so many different ways. And I just put out a plea to everyone to wear a mask, to stay socially distanced, to wash your hands, to keep your groups to small numbers. And part of this is as a former hospital nurse, I know that working on that hospital floor in good times is difficult. And I am so concerned about the nurses, the doctors, the staff in the hospitals right now, because what they're going through is extraordinary. We need to start protecting ourselves so that we can stay out of the hospitals. These folks are working grueling days, day after day, taking on extra shifts, extra hours, dealing with just unfathomable stress. And they are not, if you run out of toilet paper in the store, you can improvise. If we run out of nurses, out of staff, we can't just make do. So let's do the right thing right now, and let's get our numbers back where they need to be, and then we can get back to normal, and we can start taking care of our hospital staff just like they've been taking care of us.
Thank you very much, First Lady. We are going to have our last question come from Waverly Monroe from KETV.
Good morning. So I wanted to ask about, is there anything more specific that you guys will be doing with this campaign to target specific groups of people who refuse to follow, mask mandates, socially distancing, is there anything on top of just the umbrella of this campaign that will specifically, call it what you will, infiltrate these groups to try to get them to follow the guidelines?
Beverly, this is Adipur, and I may just start out. I think the campaign is really focusing on positive messages and is focusing on what every Nebraskan's lives look like. So my hope is that some of those messages, and I have seen some of the videos, and I have to say they are wonderful, that some of those messages are resonating with everyone. And so hopefully somebody who may have been a little bit skeptical of doing A and B, that they are saying, I value these people, and I come from the same background, and I can do this. So we are hoping by making this really real for Nebraskans, the message resonates more with everyone.
Thank you very much. This will conclude our webinar and our press conference this morning. We want to thank all of our panelists for their time and expertise, to thank all of our partners for their support, and to thank all of the members of the media for participating and helping us spread this campaign. Thank you so much and have a great day.